Hey, tonight you're watching I Love My Job with Doug Theaker. Oh my golly, we're so glad that you're out there. We thank you very, very much. We've got a great program like we always do right here on I Love My Job, because I'm going to introduce you to a young lady who is doing a wonderful job with ReVision, Paige York. Hi.
Hello, good morning.
Good to see you.
Thank you. Nice to see you too.
And you're working terribly hard.
Of course, of course.
Great.
It's great business to be in.
Okay. Let's talk about ReVision. That's what you're the expert in
Yes.
and about. First of all, you are the Director of Development. Am I saying that correctly?
Sure, that is correct. That is correct.
Explain that to us.
Of
What's your job?
Of course. So first, understanding what my job is, I work at ReVision LASIK and Cataract Surgery, and we do just that. We do LASIK and cataract surgery at our facility. And so part of what I get to do is be a part of the education and informing people, here's who we are, here's what we do, here's how we can help you see better. And that's really a large part of what I get to do is community engagement, patient engagement, doctor engagement and teams, and just really making sure people understand that there's choices out there in what they can do and have done to help them see better.
You got a big job.
Oh, it's nothing compared to Dr. Schumer, but yes, thank you.
So in essence, you are a teacher.
To some degree, sure. Education, it's a key part of everything that we do. We're at ReVision, it's really important to understand who we are, what we do, and I just get to be a part of that process and educating people about their vision, their health, their benefits, anything that needs to be conveyed to the general public and patients, and providing the best care possible.
Okay, great. Okay, where are you located?
So we have two locations. The location in Mansfield is on 240 West Cook Road, which is very conveniently located for this area. And we also have another location on Polaris Parkway in Columbus. So we have the two main locations, and then we also have some satellite locations where our doctors go and see patients off-site as well.
Okay, now do you work both locations or just in the Mansfield?
I do both locations, and I've been with the company coming up on 20 years, so I love what I get to do. It's really exciting to just see the dynamics of what's happening in vision care field.
Okay, one of the things that, keep in mind I'm old, so I'm going to give you a personal one, okay?
Yes, great.
All right. Consequently, obviously, I associate with people my age and sometimes younger, but normally that's the case. And you know, it seems like every time that we involve in a conversation, the number one issue is our eyes.
Of course. Well, you know, as we grow older, things change, including our vision. And because we use our vision every single waking moment of the day, that's something we will focus on when it's not the best vision possible or when we notice changes. So, you know, it's understanding, you know, vision as we grow older, what does that mean? And how do we take care and preserve our sight? And so, again, that's why it's really important to get in for routine annual eye exams with your eye doctor, taking advantage of asking those questions when you do notice those subtle changes in your vision. The eyes are kind of the gateway to your health, so there could be other issues happening as well. So these are the exciting things to be aware of. So when you're talking with your friends, you know, the first question should be, when's the last time you've had an eye exam? It could be even friends of yours potentially.
Yes.
Cataract development, which is the most common procedure done in the United States.
I'm raising my hand because I'm one of those.
And
I are one.
You are one. Good. Well, we can help you, but that's the most common procedure done in the United States, and everybody will get one if they live long enough. And it's just the natural aging of the crystalline lens inside your eye.
Okay, number two. Okay, I'm going down through the line here.
Great, bring it.
And I'm talking to these people, or they're talking to me.
Of course.
Okay, and we're talking about vision. Let's stick with that for a moment, just okay?
Of course.
Okay, one of the things, or the second thing that I always hear people say, and I'm one of those, so I'm going to make a confession to you, a testimonial.
Great.
I want a professional. I want somebody that knows what in the world that they are doing. These things are very important in my life, obviously, and everybody. I mean, we all. Again, the Christmas lights and everything, we could go on. All right, now the point of it is, I'm looking for somebody that is a professional that really knows what they're doing.
Of course.
Tell me about ReVision and tell me about the doctors there.
So, you know, that's so smart, and we are so fortunate to live in a day and age where we get to have the choice of who we get to see for our care. Dr. Jim Schumer is our surgeon and medical director at ReVision. He's been doing this for over 25 years. He's not just a doctor, he is a board certified ophthalmologist, fellowship trained. He's done extra schooling to actually ensure that when he's dealing with procedures, everything he's doing is on the front of the eye. He's done extra schooling to ensure that he knows exactly what to do when it's an easy case or when it's a complicated case. And that is really important. We don't try to be everything to everyone. We try to be really good at what we do, which is on the front surface of the eye. So when we talk about doing a cataract procedure or a LASIK procedure or something cornea related, that's the front of the eye. And so working with a surgeon who is specialized in just that little area of the eye is so crucial and important.
Let's take a quick break.
Of course.
Paige York is who we're talking to, ReVision LASIK Surgery, right here in Mansfield, Ohio on Cook Road. She's got all of the answers, and we're talking about professional people which are at ReVision. Don't go away. We're coming back. We want you to come back. Hey, welcome back to I Love My Job. Once again, I'm Doug Theaker. We're talking to Paige York, and she's with ReVision. She is the director of development there, and obviously an educator, really. And, you know, that's interesting because that's what we're all about here on WMFD. I Love My Job. Education, education, education.
Of course.
And you're all part of that. And that's
am.
wonderful. That's good.
Thank you.
Okay, now, one of the things, again, you know, I'm going back, not only personally, but I hear people say this all the time. The best person that knows their body is that person.
Of course. That's true.
So the point of it is, what are the red flags? What are the signs that I should be telling myself, hey, this isn't working?
So that's a great question, because not just for each individual, but also loved ones and caretakers, when you start to exhibit signs where you don't like doing things you normally used to do. Driving at night is probably one of the biggest things. People go, oh, it's raining out, I don't want to drive. And that's because when you have that clouded vision, it can create not your best quality vision and make it unsafe for them to actually be out on the road when it's dark on unfamiliar roads, it's raining. And because when you have a cataract, it scatters the light and it doesn't create good, clear vision. So what's so wonderful is those are things that insurance companies, when you have those complaints, that's something where medically it then can be a qualifying procedure to have a cataract removed. Colors aren't as bright, so whites don't match, or you start having navy and black socks on. Have you ever done that, or you couldn't tell the difference between a navy and a black sock? Those are some things that I think day to day everyone experiences when it's the things you stop doing because you don't feel comfortable, safe, or able to enjoy it as you once did.
Okay, help me with the procedures. I mean, I'm walking in, or I call, whatever the case may be, obviously, and I'm asking or making an appointment. Let's do that. I make the appointment, and again, obviously, you walk in with a certain amount of apprehension and a certain amount of fear, and of course, obviously, you know, I don't need to tell you, you're the expert on this, but boy, when you start talking about my eyes, whoa, time out, folks.
I know.
Don't touch my eyeballs. I don't want any of that. What have you. But tell me what happens.
Sure. So, you know, everybody walking in our door is a little bit anxious. It's their eyes. I have had personal friends, my own family, have procedures done, and even though they know they're going to be okay because they trust me, it's still, when it's your turn going through it, it's your own experience. So from the first time you call our office to how you're greeted to how you're handled when you walk in the door, we want that to be a warm, inviting, welcoming experience. We have extremely qualified technicians who are taking your measurements, and then you meet with our doctors who will then give you that rundown. Here's what's going on. Here's what we're seeing, and here's what we can do to help you. Everybody's nervous, but when you feel educated and informed, it makes that decision so much easier, I think, when you're going through the process. The surgery itself, again, you know, you're going through something no one wants to have to go through, but cataract surgery is the most common surgery done today in the United States.
No kidding.
And so it's done every day. And at ReVision with Dr. Schumer, we aren't using needles to numb the eye. We use everything with topical numbing drops, and we hold the eye open for you. Really, we just need patients to show up and then follow directions, because we're not going to let them make any mistakes with the procedure. Everything is in Dr. Schumer's control when he's doing procedures. And that's the beauty, is he even talks about doing verbal anesthesia, where it's talking through the patient, through the procedure. You're doing great, and it takes only 10 to 15 minutes to do cataract surgery. So it's a pretty advanced procedure at this day and time. It's not cataract surgery from 20, 30 years ago. This is minimally invasive procedures that help people see better almost immediately. So
okay, there's two words that you use that fascinate me, and let me go back to those. Okay. One is the word trust.
Yes.
Tell me about Dr. Schumer and the staff and the word trust.
Of course. So, I mean, trust is often earned, right, by your actions and making sure that what we're offering and delivering matches. And, you know, he's a trusted surgeon. He's a proven surgeon in the fact that we've been in this industry, in this market for over 20 years, and people trust Dr. Schumer because of his skill set, because of what he invests in his technology, in his team, allowing his team to be a part of that education process as well. He is extremely talented and knowledgeable in what he does, and his whole mission is to help people see better. And he is someone who loves what he gets to do every day, which is to help people see better. And to be a part of that as a team member is so, so critical and important. And so I think that trust bleeds out. When you have dedicated doctors who care about people and their eyesight, that trust is earned, and then it's delivered.
Yeah. Very well put. You're watching I Love My Job. We thank you for that. We're coming right back with Paige. Don't go away. Once again, we're talking to Paige York, and she's the Director of Development. We're talking about ReVision LASIK Cataract Surgery right here on Cook Road. Now, to follow up my conversation, again, another, you know, and I'm really giving you experiences that I hear all the time from people. Of course. Because, again, I'm old and I hear those people talking. Give me a follow-up now. Once I've gone through the procedure, am I going to see this doctor again, or is it...
So that's
deja vu. I mean,
that's a great question. So the answer can be yes if you want to see Dr. Schumer again, but there's other doctors in our practice and other trusted doctors that we work with in the community who can also provide follow-up care long-term as well. So follow-up care is absolutely imperative after any kind of surgical procedure. And depending on procedures, we may say, we want to see you for all these follow-up exams. However, if the surgery is a success, which that is pretty much 100% of the time we're having that success, people can go back to their own optometrist and resume their routine exams with them. However, we are open to seeing patients with insurance because we're all medical. We don't take vision insurance, so people would come through our center strictly on the medical insurance side of things for exams if they wanted to continue routine care with us. So the question and your answer is yes. However, you can also seek long-term care if you have your own eye care optometrist or professional.
And that's good news to hear, because again, it's almost two-parter. I want to make sure that I'm cared for, but by the same token, don't keep dragging me in.
Oh, of course.
And ReVision does not do that, and that's wonderful, 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 and that's what it's all about. I'm looking down some of these questions, and I'm thinking about, you talked about insurance?
Yes.
Okay, not an issue there.
So cataracts, cornea, anything that's medically related to your eyes, to your vision, to your sight, is run through medical insurance at our practice. So if you have Medicare, if you have any of the major medical insurances, because those are medical diagnoses that we can bill for. We don't prescribe and have contacts and glasses at our center, because that's not what we're good at. What we're good at is, diagnosing and treating people who maybe have corneal issues or cataracts, and then taking care of them. That's where an optometrist could fill a pair of glasses prescription if needed. That's more vision insurance plans versus medical, but we accept most all of the major medical insurances. It's a tricky world now with medical insurance, and they don't make it easy for consumers. So, if anything, with it being enrollment period right now for a lot of people getting on board with medical insurance, making sure you have plans where you have doctors actually participating. I just spoke with a doctor yesterday whose mother has a cataract, and she's on an insurance plan that no one in her area accepts, and so she's struggling to even find a provider. Wow. So it's really important, if you're going through and choosing medical insurance for yourself, that you're also looking at not just what the cost of it is, but what are the providers, and making sure you have trusted and specialized providers for things you may need as well, because you could have an insurance you can't use anywhere.
Yeah.
So that would be something I would just want to warn viewers as well.
Well, let me give you one. I don't want to confuse you, okay? What about the VA?
The VA. So veterans have, I know that there's clinics within the VA as well, locally, and they are able to do it. As far as their benefits go, I'm not as familiar with how the VA benefits work for individuals in surgery. I know that we've had veterans come in. We've been able to use TRICARE with Medicare and TRICARE, so we are providers with that. However, again, I wouldn't want to make a blanket statement on VA benefits.
Well, it's very confusing, and the VA tells you one thing and somebody else another thing, so that's
insurance. Wow. That's insurance
How do you
companies.
know? So again, ReVision, we're talking to, of course, again, we're talking to Paige York, Director of Development, and we're talking about LASIK surgery right here in Mansfield, Ohio, and we're not going to go. We're going to stay right here, so we're going to ask you to stay, okay? Again, I love my job with Paige York, is who we are tonight, and it's great. LASIK surgery, woo! Okay, talk to me about that again.
Great. LASIK is awesome. I had it done myself over 19 years ago by Dr. Schumer.
Whoa!
It's a safe, effective, proven procedure. I don't regret ever having it done, and I encourage people who are thinking about having LASIK surgery to really consider it. Not only is it freedom from full-time glasses and contacts, cost-wise, it saved money over the cost of time, over the length of time between not having to buy contacts and solution and glasses, and I can actually invest in good pair of sunglasses and, the other things to protect my eyes. And, one of the things, because LASIK is not covered by medical insurance, which is great because it allows people to then choose where they get to go.
Right.
But what's really cool is you can actually set up health savings accounts or flexible spending accounts. You're starting to see businesses really incorporate these type of plans that give their employees a choice of how they want to spend their medical money. And LASIK is a great option for people who are thinking about doing that and using a flex spending or a health savings account. And they should talk with their employers and their HR to determine how that works. Some of these you can accumulate over time to build up money. Some of them you can actually have to use within a defined time period. But we also have outside financing options, some which are 24-month 0%. So you can really budget for it. And when you think about it, giving the gift of sight to yourself is a great gift.
Yeah, priceless.
It's priceless.
Yeah, absolutely.
So if you're still
I can see. I mean, it's great. And again, all of the things that you talk about is again, I experience only personally, but with the people that I talk to.
Right.
I mean, they are there. They are part of that. And I hear it all the time.
And that's exactly what we get to do. We get to do it with LASIK. We now get to do it with cataract surgery and how we get to help people see and reduce their dependency on full-time glasses. And that's really exciting. People who have worn glasses or contacts their entire lifetime, and now they can have a 15-minute long procedure and, you know, from glasses to, you know, visual freedom.
Yeah.
How cool is that?
Did you hear that? 15 minutes? You got to be
cool.
kidding me.
It's pretty cool.
I mean, that is really, really great.
Right.
You know, one of the things that I need to do is I need to get you back here. One of the things I'd like to delve into with my eyes, or anybody's eyes, doesn't matter what we talk about, is related or unrelated diseases.
Of course.
I mean, I don't have time tonight, but I mean, again, I talk to people who are diabetic.
Right. Really important for them to get routine exams, and that's something covered by medical insurance, getting a diabetic eye exam. That is something super important because oftentimes people can have onset earlier cataracts because of that. They can have vision fluctuation if their blood sugar is off. So it's extremely, extremely important if you're diabetic to keep up with routine exams. Let them get some photos of the eye, the back of the eye, to make sure the health overall, because you can't you can't gain sight back once it's lost.
I hate to tell you, my time's up.
Oh,
you're good.
Oh, well, what a fun day.
I thank you very, very much. I'm Doug Theaker. You've been watching I Love My Job with Paige York. And again, we're talking about the people on Cook Road ReVision. Please give them a call. Stop by. You can walk in, right?
That's sure.
And there they are. They're pleasant, great, companion, and compassionate, and trust. How about that? Hey, we're coming back next week for more of I Love My Job. All we need is you, obviously. Tell your friends and neighbors. This is TV really worth watching. Thanks for being with us, and good night.